So today is going to be a little bit interactive. We're going to continue the discussion on myths. If you all have noticed, I've opened up a Facebook group titled Mental Health Talk with Dr. Leslie Rogers. If you haven't already, please join that group. The discussions in there has been awesome. We've been talking about myths, and then we jumped over to discussion on marriage. Do marriages last as long these days, right? I was seeing a few people on Facebook posting for like 45-year anniversary, 20-year anniversary. And I thought that would be a good discussion to talk about. Look, y'all, I'm at home and I can hear these footsteps. Here he comes. Coming to be nosy. Hey, Ted. Y'all want to see, look. This is what happens when you work from home. But the discussions have been awesome on Facebook. So please, if you have not joined, please join that group, Mental Health Talk with Dr. Leslie Rogers. So cool, let's get started. Guys, my name is Dr. Leslie Rogers. I am the host, a psychologist and host. Let me do that again, because Teddy, go upstairs. Go upstairs. Go. My name is Dr. Leslie Rogers. I am a psychologist and host of Mental Health Talk. The goal of Mental Health Talk is to promote ongoing dialogue around mental health and well-being. And it has been so awesome because guess what? That's what we've been doing. We've been promoting dialogue around mental health, and it's been a wonderful experience. We've been working towards decreasing the stigmas, guys, and I'm so excited. So today I wanted to continue that discussion around myths around mental health. Why are myths important, right? They are important because myths can actually influence our belief system about mental health, about therapy engagement, about a lot of things. Myths can also result in stigmas and discriminative behaviors, right? So we're going to go over what myths are and some potential myths that we have. And I want you guys to be interactive because as in the group, I want you guys to kind of type in myths that you believe too, right? One of the myths that is a huge myth, right, is mental health is the same as mental illness. Mental health is the same as mental illness. Well, we know that it's not. They're two different, right? They're two different concepts. And I'm going to go over that now. And then we're going to go over the list of myths that you guys have come up on, have put together on the Facebook group. So mental health involves being able to function and be engaged in day-to-day living situations, right? That's mental health, like positive mental health. Being able to be a part of the community, being engaged, and it often results in productive activities in work, school, or other settings. You're able to function. You're able to go to work every day, right, and get the job done every day. Healthy relationships, you're able to develop and maintain relationships, healthy relationships, right? Ability to adapt and change and cope with adversity. We all go through stressful situations. We all get stressed. But with mental health, you're able to cope through the normal day-to-day stressors. So that's mental health. As opposed to mental illness, guys, mental illnesses are diagnosable. Refers collectively to diagnosable mental disorders, health conditions involving significant changes in thinking, emotions, and behaviors. Distress and problems functioning in social, work, or family environments and other environments as well. So with a diagnosable disorder, the stressors are significant, right? You're under significant distress that's impacting your day-to-day living. Remember, mental health is being able to function in day-to-day living. When you talk about mental illness, the stressors are so intense, significant, that they impact day-to-day living. So, and that's the American Psychiatric Association. So many people who have mental illnesses don't often want to talk about it, right? They don't disclose, and we talk a lot about that. Many people, especially the male population, don't really want to talk about mental illnesses because of negative consequences or fear of being ostracized. So they don't really talk about it. But mental illnesses is nothing to be ashamed about. It's often a medical condition, according to American Psychological Association, just like heart disease or diabetes. And mental conditions are treatable. They are treatable. I'm going to repeat that. Mental conditions are treatable. Mental health conditions are treatable. Mental illnesses do not discriminate. It doesn't discriminate based on race, age, gender, where you come from, your income. We all are susceptible to mental illness. We all are, right? So while mental illnesses can occur at any age, 3/4 of all mental illnesses begin at age 22. I'm sorry, at age 24, according to research. While mental illnesses can impact us at any age. See, guys, I'm working from home. While mental illnesses can occur at any age, 3/4 of all mental illness begins by age 24. So I thought that was important to know. When I come on here, I try to add research to create awareness, because this is what it's about. So mental illnesses take many forms. Some are mild and some are severe, right? Some are mild and some are severe. And only interfere in limited ways with daily living, such as certain phobias, abnormal fears. Other mental conditions are so severe that a person may need to be hospitalized, right? So I want to talk about myths because it's important. And again, myths can kind of impact the way we think about things and the way we interact. And it can impact important care when we need it. So let's talk about myths. One myth that we just talked about was the difference between mental health and mental illness. There is a difference, it's not the same, guys. Okay. Another myth is people who experience mental health issues are attention seekers. And I thought that was an awesome example, because you often hear that, especially with children, right? Have you guys ever heard a parent say, "Oh, she's just seeking attention. Oh, he's just seeking attention"? Have you guys ever heard that? Yeah, I've heard it a lot, right? And especially around suicide. I've heard parents say when children contemplate suicide, "Oh, she's not serious. She's just paying attention. I mean, she's just seeking attention," right? And you know what my response is? Give her the attention. If she's just seeking attention, give it to her, right? If he's just seeking attention, give it to him, right? You can't take things, not take things like that, like suicidal thinking. You cannot take it seriously, right? You have to take it seriously. Even if you think that the child or whomever is attention seeking, give them the attention they need, right? Get them to a professional, let them be assessed. Even if it's more than one time, if it's 2, 3 times, 4 times, 10 times, 20 times, give them the attention they're seeking and get them to a professional to be assessed, right? Yes, Melissa. Melissa says, absolutely, I've heard that before, because it's common, and that's a myth. People that suffer mental health are attention seekers. Another myth, and so remember, I just said that myths can result in discriminative behaviors or stigmas. Another myth, gay persons or members of the LGBTQ population suffer from a mental illness. That's a myth. And it's a stigma, right? And it's discriminatory, and it can result in discriminatory behaviors, right? So we have to be careful of the myths, our myths, because we all have myths. We all have stigmas. We all have biases. We do. Some may not agree to that, but I believe that we all have biases. And it's important to understand what those biases are. So we're talking about myths. Can you guys think of any other myths? There were a list of myths listed in the Mental Health Talk group. Can you all think of other myths? Geraldine, hi Geraldine, how are you? Thanks for coming. Melissa, Sharon, Tanya. Can you guys think of other myths? What are myths that you guys have heard that aren't really true about mental health? Another myth, therapy doesn't work. What do I need to go to therapy for? Therapy doesn't work, medication doesn't work, right? And a lot of folks stop taking medication because they believe it doesn't work. That's another myth. And it can interfere with progress. It can interfere with recovery. These myths, right? Myths about medication. Oh, medications don't work. They just want to, what have I heard? It's a money builder, right? It's political. It's a money market, medications, right? A myth. That can potentially interfere again with recovery and with services. Other myths, and this was listed on the group. Children don't experience mental health problems. That's a huge myth. Children don't experience mental health problems. Where in fact, children are diagnosed with anxiety. Children are diagnosed with depression. Right? So that's a huge myth. Tanya says, people with mental illnesses are unintelligent. Yep. People with mental illnesses are unintelligent. Whereas you'll find that high up corporate officials suffer from mental illness. And we're seeing that in sports professionals are now suffering from mental illnesses. It doesn't matter what degree you have, doesn't matter what role you're in, it doesn't discriminate. Right, so that's a myth. Unintelligent people suffer from or mental illnesses, right? People with mental illnesses are unintelligent, which is a myth. That's not true. Any other myths that you guys can think of? Another one, there is no hope for people with mental problems. Once a friend or family member develops mental health problems, he or she will never recover. Once you develop a mental health problem, you'll never recover. Which of course is not true, right? Research shows that therapy outcomes are an awesome tool. Talk therapy is an awesome tool for recovery for mental illnesses. Now again, on that spectrum from mild to severe mental illness, right? A person is assessed to determine what the best course of action is therapeutically. But recovery is, people with mental illnesses can recover. They can be stabilized, right? Even with severe mental illnesses, you can be stabilized and live a prominent life and live a meaningful life. People with mental illnesses can live a meaningful life. Yeah. What else? It's another, let me see what other myths are up here. Therapy is a waste of time. Why bother? Therapy is a waste of time. Why bother? Hey guys, let me tell you. When I was in a doctoral program, I went to therapy. It was in Carrot. And it was the best thing that I have ever done. I think that when you go into therapy and you have the right person, there's a good fit, therapy, patient fit, it's an awesome experience because you're speaking to someone that's non-judgmental, non-biased. We can talk to our friends and our families and support systems, right? But sometimes I feel like they can be a bit judgmental, just as I can be a bit judgmental because there's that personal aspect, that personal component between you and your loved ones and your support system. But when you go to therapy, you can talk about a lot of things, it's confidential and it makes you feel good because it allows you that outlet to vent. So therapy is a waste of time? Absolutely not. It's not. I'm here. I'm living proof that it is not a waste of time. And I would hope that as a psychologist, I've changed the lives when I was working with patients. Okay. So any other myths that you guys can think of? Let me see. I think I covered a lot. I can't do anything for a person with a mental health problem. Oh, a lot of people feel this way. I can't help people with mental health problems, right? I can't help people with mental health problems. the best course of action is to, if they need help, get them the help that they need. How to do therapy, how to do hospitalization, how to do groups. There are ways to help people with mental illnesses, but it's sometimes challenging, right? It can be challenging for loved ones, for families. It can be quite challenging. But support is the baseline for that. Another myth I wanted to talk about was people with mental illnesses are aggressive, are dangerous. And I wanted to talk about that because we see that, how do I want to say this? We see that even with police killings, some of these folks were suffering from mental illnesses. Mental illnesses are aggressive. People with mental illnesses are aggressive, are dangerous. And that's not always the case. It's not always the case. Are some people with mental illnesses, can they be potentially dangerous? Yes, but that's not always the case. It's not always the case. So that is a huge myth. And again, myths influence how we think about others and can potentially lead in discriminative behaviors. Yes, Sharon brought up, just pray about it. I'm not dispelling it. Sharon isn't even dispelling religious beliefs, but I remember growing up in a family with mental health, struggling with mental health issues, and the common word for us was to just pray about it. Pray about it, and God will see you through. Now, when you say myths, you're not saying that your religion, that's not true, because I do believe, I have a faith base, and I do believe that prayer solves a lot of things. But I believe that people are put in place, such as psychologists, psychiatrists, other clinicians are put in place as well to serve a purpose to help you get through struggles as well. And that brings me to, I am going to have on the show, and one of my segments are, can you love God and seek therapy? Can you love God and seek therapy? I think that's going to be a powerful show. So I'll keep you guys up to date on that. Yes. So we've talked about myths and how myths can possibly be an influencing factor in engagement, therapy engagement, and how we deal with others and how we interact with others. And it influences behaviors. You know, it can result in negative behaviors towards others and towards engagement. One thing I wanted to say before we end is, how do you think myths come about, right? How do you think myths come about? Oftentimes myths come about from learning, childhood experiences, learning and experiences, maybe through peers, learning from other people. How do you think myths come about? You don't just wake up in a bed. I mean, you're not just born and wake up. We're born with a blank slate, right? You don't just wake up and say, oh, this is how I feel. Myths come about from ignorance. Yep, in part, ignorance. Melissa Gill says myth is from ignorance. Yes, from what we don't know. What we don't know. So how do you dispel myth, right? By creating awareness. If it's something that we don't know about, and let me tell you, if we don't know about something, as people, we become anxious. We become anxious and fearful. So how do you dispel myths? By creating awareness, by doing research, creating awareness, education. There's many ways to dispel myths. Talking about it, such as what we're doing, promoting ongoing dialogue around difficult and challenging areas, discussion areas, which is what we're doing, right? This is the best way to dispel myths and decrease stigma, by talking about it, by creating awareness around mental health, right? Myths come from fears. Excellent. Michelle Gwynn says myth comes from fears. Absolutely. It's that fear factor, right? That fear factor, what we're afraid of. Melissa says having these uncomfortable conversations matter so much. And you're right, they do. And this is the place to start, right? And I think, because of COVID, the pandemic, that's when these conversations started to become real, right? And my mission is to keep these conversations going, because I do believe that the more and more you talk about it, the more and more it becomes normalized. And we feel comfortable. The more and more we feel comfortable about talking about it. And even in the difficult, even when the conversations are difficult, right? When talking about mental health, let me tell you, mental health is scary within itself when talking about it, especially when you don't know how to deal with it. You don't know how to deal with mental health. It becomes challenging and it's scary at times. But creating awareness reduces that fear. So absolutely, Melissa. So this has been a great discussion. I want you guys to kind of think about, even when you go back to your lives after the show, I want you guys to kind of think about, what myths have you heard? What have you believed about mental health? What have you believed about people who experience mental health or suffer from mental health? What are your thoughts about that, right? I want you to think about stigmas or biases. Again, I believe we all have biases. And if somebody don't agree with it, tell me what, just talk about it. Let's talk about it. But I have biases. I think that we all have biases. But, we can overcome biases by awareness, creating awareness. Sharon says, an acronym for fear, false evidence appearing real. Trust or not, fact-based. Okay, yes. So fear, again, that fear factor. We're afraid of what we don't understand, right? That's the case for discrimination. We're afraid of what we don't understand. That's the case for in other contexts as well. We're afraid of what we do not understand, right? So my encouragement to you all is to think about this. Think about what your biases are, right? Think about what myths you may have experienced and how you've overcome those myths. And let's keep it going. Keep the discussion going, because it creates awareness around this whole mental health thing. This mental health movement, I call it, because that's what Leslie Rogers is creating, a mental health movement. A mental health movement. I also am creating a movement around men suffer too. Like for instance, I see only female women on here discussing mental health. My movement is to get men involved. To let men support each other, and teach each other, learn how to love themselves, and learn how to speak up and be okay about speaking up, learn how to speak about mental health in order to achieve healing and recovery, right? Learn self-care. Self-care isn't only for women, it's for you too, men. So men, where are you? I am on a mission, and I am ready to involve you as well into this mission, into this movement and discussion. So thank you guys so much for coming. Is there any other comments that you'd like to make before we end? This has been awesome. An awesome discussion. And next week, so my plan is to, when I don't have guests, come on and just talk about increased awareness around mental health. Come on and talk about those difficult discussions. I was thinking maybe I'll come on and talk about different diagnoses as well. Go through different diagnoses and symptoms and talk about that as well. So I think that's important. Again, fear is because of what we don't understand. So why not just go through different diagnoses and talk about what symptoms are and things of that sort. Thank you guys so much. You guys are awesome for supporting me. I am on here every Thursday at 7:00 p.m. Eastern Standard Time. And again, if you guys have any discussions that you want had, just let me know. Just reach out to me. If you haven't already, please subscribe to my YouTube channel, Mental Health Talk with Dr. Leslie Rogers. Also subscribe to my group, because there are important conversations had in that group too. My idea is to get you all involved as well and jump in on these conversations as well. So yes, join the group, join Mental Health Talk YouTube page. Go to my website, mentalhealthtalk.live, mentalhealthtalk.live, and you can join everything that I'm on. Facebook group, Facebook page, YouTube. You can join, subscribe from there as well. But please make sure you subscribe, guys. Thank you so much. This has been an awesome, awesome discussion. Let's keep it going. Don't end it here. When you jump off, continue the discussion. So if you guys if anyone wants to be on Mental Health Talk or think you have someone that might benefit, go to the website, mentalhealthtalk.live, and fill out the contact form. I'll get the contact form, and then my promotional team will go through it, and I'll have you on the show. So thank you guys so much. I can't wait to see you again. And until next time, peace and blessing, guys. Thank you so much.